Go ahead. We put it in, and how's the pain been?
It was like I instantly felt better.
Yeah.
But I had no pain. Like I can get off the recliner. You ever sit on the couch? It's a little low, and I'm like I gotta like grab the table or something to get up. I got instantly like up. I felt good. And
has that been maintained the whole time?
100%. For me, it did. It worked. Listen, it maintained. Like I said, when I tell you I felt like a spring chicken, like there was things I wanted to go do. I was like, oh, I want to see if I could, go do this without pain. And then I'm like, oh, I'm gonna trust the process. But like I said, I went and I did something I probably shouldn't have did, and I was like,
how long? So you did it. You did. So what do you usually do then? You work for sanitation.
Yeah.
What do you usually do?
I do. We do collection. We do like 12 to 13 tons of garbage.
So you usually drive and let the other guys collect it? Or how does that? Because
you know what it is. Well, for me, I've dealt with back problems my whole pretty much 20 years, and for 20 years, and I was like, I really wanted to see, does this work? Does this work? Because like I said, I've always said like back surgery. I've seen people, and there's no way it was an option for me. So I said, screw it. I'm gonna try it out. I know I shouldn't have, but I was feeling that good. And then when I was doing it, I'm sitting there and I'm picking bags up. I'm talking like 200-pound bags. I'm picking up 200-pound bags, and like I said, I was listening to what John from St. Jude was saying, but I bent down a little and I was shoving them. But the point is, after I was done, I didn't feel that like, oh my God, like getting out of the truck. I felt great. I felt.
And usually you don't lift those bags.
Well, no, because like I said, usually you get a little help. But like I said, I felt that good. I mean, like I said, like usually, like you're done, doing work, and you take your shower, and you're like, oh, I'm shot. I felt fine. I felt absolutely fine. I mean,
and you slept better.
The if any part was the best part was the sleeping part. I haven't slept like this in years. Like even this morning coming here, I couldn't even. I had the alarm set for 8:30 for a 9:30 appointment. I had a problem getting up because I didn't want to get up.
Usually that's not the case.
No, usually I'm like tossing and turning. I'm like a hot dog on a wheel, like all night, spinning with my back. And this thing, it's been. I got a call. My wife.
What about pain medicine?
Well, the truth is, I really wanted to see for myself. I had, when you have problems for 20 years, and she knows, I wanted to see how this worked, and I'm gonna not lie to you. I take Percocet. What is it? 10, and
like 4 or 5.
I said, screw it. I'm not even gonna take it.
And so you didn't take any.
I didn't take any to go to work.
Shut the hell up. So for the last week, you didn't take one fucking Percocet.
I swear to God, I didn't take any Percocet.
And you usually take like 4 to 6 a day, 5 a day.
Listen, sometimes more, because you know what? Like with work, sometimes before I go on the truck, I gotta pop 2 so I can get myself going and take one after I'm done, and then one to sleep.
How many injections do you think you've had over the last 10 years?
I mean, I would go in the last 20. I mean, a lot. I mean,
50?
I would say more than 50. I would say more than 50 between the SI joints and in the beginning with epidurals, RFAs. I mean, like, who the hell wants to come here and keep getting?
Listen, bro, I know you come here after work and all that crap.
Like I said, like, who wants to? But like for my family, how the hell am I gonna? I gotta work, for my family.
So just so you know, like the impressive part is that for the conditions that you have, having the arthritis, the discs, the sacroiliac, patients that we put these in, pretty much, they don't really come back for any procedures anymore. So it's really
that makes me happy.